Welcome everyone to our final session of our Veterinary Anaesthesia in Wildlife series. A special welcome to fourth year students from Lilongwe University of Agriculture and Natural Resources studying veterinary medicine, who are our primary audience today. My name is Dr. Sela Malanga and I will be your host today. With me is Dr. Kirsten Neke, who is my co-host. In our first session, we covered the anesthesia process in reptiles, elephants, and small wild ruminants. And in our second session, we covered giraffe, carnivores, and rhinos. If you missed these two sessions, don't worry, we got you. You can visit our Share Skin Africa channels where you'll find your recording. By the end of today's talk, you should be able to understand that reptile anesthesia is unlike any other animal class. And you should also understand that staying informed and up to date on literature is the key, as we still have incredible amount of knowledge to learn regarding successful reptile anesthesia and analgesia. You should be able also to understand that understanding the species, its individual requirement, and the physiology is the key to successful outcome. Lastly, you should know that temperature in reptile is critical. So moving on to the person who is going to take us through the session today. Our speaker today is Dr. Jessica Briner. Dr. Jessica is an exotic animal and wildlife veterinary who has a rare specialization in reptiles. She is a vet who doesn't just wait for animals to come to him, the patients to come to him, but she goes to the patients. She runs a unique mobile vet clinic that travels directly to conservation bodies and researchers. Dr. Briner's essential work provides unique specialized care and support to wild and rehabilitated reptiles right there in the field. So, Dr. Jessica, we are so happy to have you as our speaker today, and the screen is all yours.
Thank you very much, Stella. Fantastic. Morning, everyone. I'm sure that people are joining from different time zones. My name is Jessica, like Stella said, and I am a wildlife conservation veterinarian here in South Africa, in Hoedspruit, South Africa. And I have a special interest in reptiles, so I'm quite excited to speak to you about that today. Today, we are going to be specifically talking about reptile medicine and anesthesia. And so I hope some of you guys get to learn some things about the animals that I'm very passionate about. Before we jump into the medicine side, though, it is really important to understand what a reptile is. So reptiles are covered in scales. A lot of people think that this is to help them for protection against predation, but actually the presence of scales in reptiles is largely to help them with the prevention of desiccation or drying out. In addition to that, reptiles are cold-blooded. That does not mean that they have cold blood. It means that they are ectotherms, and they rely on their external temperature to regulate their body temperature. So if it's a warm day, which we are not warm here today, it's gray and horrible, then they'll go and they'll sit in the sun. But if it's a cold day like today here for us in South Africa, then they're going to be hiding until the sun decides to come out. Why is ectothermy important? It's important because reptiles have a temperature-dependent metabolism. So as their body temperature goes up, their oxygen consumption is going to increase and their metabolic rate is going to increase. That means that reptiles need to be warm to digest, whether that is food, day to day, or in our context today, in terms of clinical context, they need to be warm to metabolize drugs. We also need to look at reptiles as a whole. The reptile class consists of 4 orders of reptiles. We have our crocodilians, which consists of our gharials, our false gharials, our caimans, crocodiles, and alligators. We have our rhynchocephalians, which is just tuataras, a very specialized lizard-like thing found in New Zealand. We have our squamates, which are lizards, snakes, and amphisbaenians. And we have our chelonians or our testudines, which are our tortoises, turtles, and terrapins. These 4 classes make up, these 4 orders, make up the class Reptilia, okay? Again, why this is important is when we're talking about reptile medicine, we are talking about an entire class of animals and not individual species. When we do veterinary medicine in school, we're learning about individual species, cats, dogs, horses, you name it. But when it comes to exotics, we're learning about bigger groups of animals. And that makes it a lot more challenging because we need to remember that for us to provide good care, we actually need to know about the individual species anatomy, the individual species physiology, and the individual species husbandry, not the general group altogether. Okay, jumping into the medicine side a little bit. When we're talking about reptiles, there are lots of different injection sites. So where are we giving medication? Where are we taking things like blood? Okay. In terms of your IM injections, when it comes to snakes, you're going to use the apaxial muscle, which is on either side of the spine. The picture on the top right corner of your screen is an example of this. That picture actually comes from a veterinary source, but the needle angle is not appropriate. You need to use a little bit of common sense as well. That needle is pointing towards the spine, and the needle needs to be parallel to the spine in the muscle on either side. When it comes to things with legs, which is basically most of your other reptiles, then you're going to go for the front legs, okay? Any of the muscle bodies that you can safely hold. When you are giving any medication, but particularly your drugs, you need to be doing this in the first third of your snake or the front limbs of anything with limbs. The reason for that is that reptiles have a very good renal bypass system, and if you give them their medication too far down along their body, they can just shunt the drugs out of the system, which means your drugs are basically not working. So again, in snakes, the first third of the body, in anything with legs, the front legs. And you rotate which side you're doing it, left and right, so that you're not just stabbing one side all the time. When it comes to IV access, whether you're delivering a drug or trying to take a blood draw, for snakes, the main point of access is the ventral tail vein, as you can see in the picture on the right side. The angle of approach can be quite challenging to learn, but it just takes some practice. But this is the main spot that you're going to do it. Literature will also tell you that you can take blood from the heart. Please don't do this. If you don't have enough experience and you take blood from the heart, you can accidentally cause an arrhythmia or cardiac arrest, and you obviously don't want to lose your patient. When it comes to lizards, you can use that same vein, so the ventral tail vein, like in the bottom right of your screen. You can also do a lateral vein, like the top right of your screen, and then in the middle of the screen, you can see a little gecko that someone is taking blood from the central abdominal vein. This is another site that I would not recommend that you use. The reason why I don't recommend using it, while that is a very good vein, it's very difficult to put any hemostasis on it. If you want to put pressure to avoid having a hematoma, you're never going to get enough pressure because of the other organs that are around there. So try and steer clear of that vein unless you have a lot more experience. Crocodilians are basically giant lizards. So you can also do your ventral tail vein or your lateral vein. But the main difference with other lizards is that you can actually get blood at the base of their head, but this does require a little bit more experience. It's a really good spot, but just be trained before you try this yourself. And then your chelonians or your testudines are by far the most different of all of your reptile orders. There's 3 ways that you can get blood from these guys. Your subcarapacial sinus, which is on the left of your screen, that can be taken from exactly where the neck joins to the top of the carapace. It takes a little bit of practice, but it's actually a really nice spot to take blood from. There is lymph drainage into that sinus. So if you're sending bloods away, you have to speak to the lab to let them know so that they can account for that lymph in your sample. The other 2 spots, there's no lymph drainage in it. You have your dorsal coccygeal vein. So that is the top of the tail, unlike all the other reptiles, and your jugular vein down the side of the neck. But for both of these, it depends on the species as to whether or not you can have access. Then for subcutaneous injections, if we are talking again about drugs, remember that for drugs, because of the renal bypass system of your reptiles, you need to do the first third in snakes and the front legs of anything with legs. But basically anywhere where you have a little bit of loose skin, you can deliver your drugs. If we are talking about subcutaneous in terms of fluids, then it's anywhere along the length of that animal. The reason why personally I'm not the biggest fan of fluids given subcutaneously in reptiles is that the space between the skin and the muscle is not very elastic. So you end up having to give lots of little boluses of fluids, like you can see in this picture, and you end up stabbing your animal quite a few times, which is not really very fair. So when it comes to fluids, the best options are IV or intracelomic. When it comes to intracelomic fluids, with snakes, the bottom end. The reason for doing it in the bottom end of the animal is that there is the least chance of you accidentally stabbing an important organ. You do need to be careful. There is technique to this as well, but it's relatively simple. You get your needle in between two ribs, perpendicular to the skin, and as soon as you're through the ribs, bend that needle straight up so that it runs parallel underneath the rib cage. Okay. You want to draw back first. If you have any air, then you are in the lung. You obviously don't want to inject any fluids in there, which means you need to reposition. If you get anything else like blood or any GI content, then take everything out, throw away your fluids, start from scratch, and reposition. For your other reptiles, slightly different. Anything with limbs that is like a lizard or a crocodilian of the right size, then you go in the abdominal region. But be careful of not accidentally injecting an organ. For your chelonians or your testudines, like the bottom right of the screen, then you need to aim that needle very sharply down towards the plastron. The whole top half of the carapace of a tortoise or a terrapin or a turtle is their lung. You need to make sure you're not injecting into the lung, so point very sharply down to the bottom of the body, draw back, make sure you're not in a lung, and then you can inject your fluids. Your intracardiac injections should be reserved for euthanasias only. Any animal that is being euthanized should be under anesthetic first and foremost. For snakes, the heart is situated either at the bottom of the first third of the animal or between the first and second quadrant of the animal. Snake hearts are mobile so that the food, or rather big food items that they eat, can go past it without damaging it. So you have to find it, hold it, and then you can inject into it. For your lizards, it's a slightly different technique. You can feel for it and then inject directly into it, or you can go through one armpit, aim for the other one, put your needle all the way in, draw back a little bit, and as you start to pull out, if you've got blood in your hub, you're in the right spot. Again, your animal needs to be anesthetized to do this, and probably most importantly, if you're doing this near a client, let's say you're in private practice and your client is there because it's the last moments they have to say goodbye to their animal, you have to explain the difference between an intracardiac stick and a peripheral stick. There isn't physically very much different, but psychologically for someone watching it, there's a huge difference. So very important to have that discussion with your clients. And then the last injection site that you can use is intraosseous. But please, guys, only with something with legs, definitely not an option in snakes. And it's something that you can use either in emergency scenarios or for fluid administration. If we shift towards managing your anesthesias and your analgesias in your reptiles, the first step before you do anything is your patient assessment. You need a detailed history of your animal. What has it had in the past in terms of medical issues? What is its current husbandry like? What is its historical husbandry like? What diet is it on? Remember that people lie, so you have to ask the questions correctly to make sure you're getting to the reality of what your animal is facing. And it's really key to understand that 99% of what you'll see if you're going to be treating reptiles is the direct result of poor husbandry. And that means it's chronic, long-term issues. Once you have your history, you can do your physical exam. If we're looking at anesthesia in the future, then you really need to focus on the cardiopulmonary system. It's also important to note that reptiles like to hide when they're sick. So if you are doing an anesthetic and you're in any way concerned, then you should be doing pre-anesthetic bloods. And at the very least, that includes a hematocrit, glucose, and total protein. You also need to assess their hydration levels. And if there's an imbalance, correct the imbalance. For any animal that is going to be undergoing an anesthesia, they should be starved for at least 24 hours. And if there's a snake, then you shouldn't be doing an anesthetic within 2 to 3 days of them having had a meal. Obviously, in emergency situations, it doesn't matter, you can deal with the issues. But in an ideal scenario, fast your animals first. So how do you assess hydration in a reptile? It is not normally this obvious. This particular snake is extremely dehydrated. To look at hydration status in reptiles, you can look at doing a skin tent, but it's not always positive, even if they are dehydrated. The other signs are to look at how sunken in or not their eyes are and their general demeanor, as well as just how much elasticity they have. Any animal that you believe needs to have fluid replaced, their maintenance level should range between 10 to 30 mils per kilo per day. But obviously there's species variation, so you need to look this up. You give them their maintenance, and then you add on the deficit. If there is a less than 5% deficit, you can give the fluids orally. Otherwise, you have to use other alternative methods. And it's important to give reptiles the right fluids. For those who have access to it, that means reptile and amphibian ringers. We don't have that here in South Africa. Probably most of you don't have that either, but you can make it. The formula is 1/3 just normal lactated ringers with 2/3 0.45 sodium chloride and dextrose. Remember that your fluids need to be warm. Don't cook your animal, but don't cold shock it either. Okay. Then, in terms of pain management for reptiles, this is a major problem in terms of reptile medicine. Reptile analgesia is still not really very well understood, and there's hardly any literature to support how effective or not it is. In order to manage pain, you need to understand pain. And it's important to note that stress from pain can affect immune function, your hematological and serum biochemical parameters, as well as the metabolic processes. So anything in pain really needs to be made to feel less pain. So how do you manage pain? You need to be able to identify pain, and that can be exceedingly challenging in reptiles. Some of the signs of pain include resting in abnormal or hunched behaviors, restlessness, abnormal gait, increased respiratory rate or effort, aggression, or anorexia. But to know all of these, you actually need to know the behavior of the species that you're treating. The top right picture there, that's a snouted cobra that is actively head pressing. A lot of other animals will head press too when they're in pain. It's very rare to see this in snakes, but that is a case there. And the bottom there, on the bottom right of the screen, is a leopard gecko with a hunched appearance. That'll be showing you that he's got some severe abdominal pain. There's also different types of pain. You can have acute pain from injuries or surgery or an acute infection. This is obviously best managed preemptively if possible, but you can't always do that. And then there's chronic pain, which can be from arthritis or cancer or joint disease. The moral is, no matter what pain you have, whether you are managing an animal that you are going to create the pain, let's say through surgery, or they already have pain, you must include analgesics in your protocol. So how can we do this? Opioids have been shown to have mixed success. Butorphanol is largely ineffective. What that tells us is that reptiles mostly have mu receptors. I don't know where everyone's at in their pharmacology yet, but very briefly, opioids and that whole category like morphine is brilliant for us because we predominantly have mu receptors. Butorphanol is a mixed agonist. It's got kappa and mu receptors. So all that's telling us when butorphanol doesn't work in reptiles is that they must not have very many kappa receptors. Okay. Any of the mus work the best in reptiles, but the dose that is needed for them to be effective is exceedingly high. And with that high dose comes respiratory depression. Literature has shown us that morphine could work in lizards, crocodiles, and turtles, but there's hardly any evidence that it works in snakes. Fentanyl patches have been shown to work in snakes, but there's a lot of restrictions on fentanyl in different countries around the world now. And tramadol very recently has entered the discussion in terms of pain management in reptiles, but there's hardly any literature to support this, so there's more studies needed. Your non-steroidal anti-inflammatories are probably the only pain relief in reptiles that have been shown to truly have an effect. It can have quite a long analgesic effect, especially things like meloxicam, but it acts much lower on the pain chain. Ketoprofen and carprofen have also been used with some success. But remember, if you're dealing with any non-steroidal anti-inflammatory, if your animal is dehydrated, has kidney disease, or has any gastrointestinal disease, you need to be very careful using them because they can come with very negative side effects as well. Local anesthetics can also be used for minor procedures. Lignocaine is much faster working, and it's great for short-term analgesia. Bupivacaine is longer acting and is helpful for your post-op pain management. Because all of our analgesics in reptiles' use and success is debated, a multimodal approach is often suggested. And that means using a combination of nonsteroidals with opioids is probably going to be the best shot. The way that I liken this is if you use meloxicam, which we know works, okay, so that's your nonsteroidal anti-inflammatory, and you've done a leg amputation, that would be like sending us home having had our own leg amputated on ibuprofen or paracetamol, which isn't enough, okay? So we want to cover our bases and use as much as possible with the hope that some of it works. And then one also needs to not forget that there are other ways of reducing or minimizing pain. You can splint an animal, or you can give it a smaller home temporarily so that it moves around less. So we're going to shift from analgesia to anesthesia. When you are considering anesthesia in reptiles, you have to understand that there are significant differences in physiology and anatomy that will influence both your analgesia and your anesthetic in reptiles. Okay. So this is something, I guess it's true for all animal groups, but even more so with reptiles than in any others. One of the major differences with reptiles is the way they breathe. They have an episodic pattern of respiration where they cycle between 2 to 3 rapid breaths and then a long pause. And also their rate of respiration varies dramatically with different species. All reptiles breathe much slower than all of your other mammals, but the rate of respiration decreases as they get bigger. So they're already slow, and then the bigger they are, the slower they get. They also have unique anatomical and physiological features. An example of this can be found in your crocodilians. If you immobilize a crocodilian, you can interfere with the closure of the glottal and the palatal valves in the crocodile. So if you're looking at that picture on the right-hand side, there's a big fleshy, what looks like tongue right at the back going up, touching the top of the mouth. That is the valve that protects their trachea from aspirating when they're underwater, okay? But if you have them under anesthetic, that valve will stop them from being able to breathe. So as a result, you have to intubate any crocodilian that is under anesthetic so that you can maintain the airway and ensure that they're breathing. Also, like I've mentioned before, temperature is really important in reptiles, and they have to be warm to metabolize their drugs properly. If their temperature goes down, their oxygen demand goes down, and by proxy, their metabolic rate goes down. If you have a cold animal and you're trying to anesthetize them, they are going to take a long time to fall asleep because the drugs are going to take longer to work. They're also going to stay asleep for a lot longer, and they're going to take a lot longer to wake up, all of which increases the risk of anesthetics dramatically. Some reptiles can also convert from aerobic metabolism to anaerobic metabolism if they are in an oxygen deficient environment. Anesthesia will reduce your respiration rate, and that means it'll reduce the available oxygen to that animal. So remember that reptiles already have a very slow respiration rate. Now you have them asleep, they're going to be breathing even slower, and that means they're going to have less oxygen available to them. So they're going to enter a hypoxic state. And if they're in a hypoxic state, they no longer need to absorb the drugs that you're busy giving them, which means you might have an anesthetic failure. To avoid this, you need to artificially ventilate your reptiles. Keep that respiration rate up, keep that oxygen usage up, okay? So intermittent positive pressure ventilation is key when you're doing any anesthetic in reptiles so that you can manage your anesthetic and you can combat your hypoxia and your hypercapnia. Another way of looking at this, kind of in the same category but slightly different, is that some species can hold their breaths, and they can hold their breaths for a very long time. These species, as soon as they smell your inhalation anesthetic, this gas that seems very weird to them, they just hold their breath and they stare at you for hours, refusing to actually take anything in because they've shifted to anaerobic metabolism, and your induction is going to be almost impossible to achieve, and definitely not within reasonable time. So pre-medication can help. Why would we use pre-medication in reptiles? Well, not just to help combat with your anaerobic versus aerobic metabolism, but also because it can make it easier and safer to handle your individuals. It can reduce the dosage of the anesthetic drugs you need to use, by proxy reducing the risk of complications or adverse side effects. And you could use complementary analgesia as well. And remember, because pain is so difficult to manage in reptiles, every opportunity you can use to help with pain is beneficial. There are two types of anesthesias that you can use in reptiles. You can use injectable anesthesias or inhalation anesthesias. Your injectable anesthetics are typically used in the field. They provide a more constant pattern of anesthesia, but they often have a more prolonged effect. So you do need to monitor your reptile carefully. The doses are extremely variable between species, so you need to look up your dosage and you need to know your drug. What are you expected to see with induction? What are you expected to see with maintenance? What are you expected to see on recovery? What's normal? What's not normal? And remember that because of that really good renal bypass system of your reptiles, you need to make sure that you give any injectable drug in the first third of the body if it's a snake, or front legs of anything that is with legs, so your lizards and all of your other limbed reptiles. Your inhalation anesthetics are typically used in hospital. These are rapid and reversible, which is great. They also have a large variation in depth, depending on how your animal is breathing or whether it is breath holding. So it's really important to breathe for them. And it's also important to consider the concentration of your gas. Because some reptiles can also cardiac shunt, the uptake of your inhalation anesthetic can vary. So it's really important to make sure that you keep your animal nice and stable and maintained. Otherwise, your animal might suddenly wake up. So you have to monitor your individual carefully. If we delve into these a little bit more closely, let's first look at your injectable anesthetics. A really good example is propofol. Propofol is a great drug. We use it in a very similar way that we would use it in cats or dogs. It can be used either as a continuous infusion or for induction, and you'll give it until it starts to show effect. But you have to have IV access, which can be challenging depending on the reptile species that you're working with. Alfaxolone is also a really nice drug to use for injectable anesthesias. It has a huge safety margin, which is nice and safe. It can be given IV, IM, or intrasalomically. It's rapidly cleared, which is beneficial, but it can result in apnea or breath holding, so you need to intubate to breathe for them. And because it can result in muscle fasciculations and tremors, surgery can be challenging. So you'll need to use it with something else if you want to do surgery. The only other thing to consider with this is that there is a huge range of dosages and species. It's typically a lot higher than it would be in a mammal. And because this drug is so expensive, it's often cost prohibitive in reptiles, even though it's a really nice, safe drug to use. Another combination that you can use is your cyclohexylamines with an alpha-2 adrenergic agent. So your cyclohexylamines, that's ketamine or xylitol. Ketamine is shorter acting. It's got analgesic properties and is good for immobilization, but it doesn't allow for very good muscle relaxation. So again, it's not the best for surgery, which is why you'll use it in combination with an alpha-2. But all your cyclohexylamines are not reversible, which means the storm you make, if you make one, you have to ride out, okay? You need to know what to expect and you need to know your dosages properly. Xylitol, much like ketamine, also a very good drug, but it's longer acting. Your higher doses will allow for muscle relaxation, so you can use it for surgery, but it's not reversible, and recovery can take 16 to 24 hours, which is huge. Your alpha-2s are used in combination with ketamine and xylitol so that you can drop down the dosage of those drugs. So obviously you would never be using ketamine and xylitol, but you'd be using one of those agents with an alpha-2. The alpha-2 offers a sedative property and an analgesic property, and it's reversible, which is great. But if you reverse your alpha-2, you are not just reversing the sedation, you are also reversing the analgesia. So just bear that in mind. And then you've got medetomidine. Medetomidine is often used with local anesthetics for minor surgeries, and it's nice because it's reversible with atipamezole. The final group to think about is your neuromuscular blocking agents. You need to be conscious of the regulations in your home countries about using neuromuscular blocking agents because they are not anesthetics, they are paralytics. You have to use them with a sedative if you're using them for surgery because of this. These drugs cause locked-in syndrome. The animal is fully conscious of everything you're doing. It can feel, it is just paralyzed. And if it's given a too high a dose, it will die because it's paralyzed and it can't breathe. Okay. Because of this, the very first one, succinylcholine chloride, is basically not used at all anymore. But galamine and rocuronium can still be used in a veterinary context for reptiles in very specific scenarios. Galamine is the drug of choice for restraint of crocodilians, at least in South Africa. It's not for anesthesia. It's to take the edge off when you're busy transporting, to make an animal that can be very dangerous less dangerous. And it's reversible, which is great. Rocuronium is typically used in your chelonians or your testudines, so that's your tortoises. And it's used just so that you can get access to be able to use other meds. So for example, to get access to the veins so that you can administer your pre-medication or your induction therapies. Both of these are never used to the point where you have to breathe for your animal. The other option for your anesthesias is your inhalation anesthesias. And this is by far the safest and by far the best. There's two options, isoflurane and sevoflurane. Basically everywhere in the world, everyone just uses ISO because Sevo is very expensive. It's basically only for people at this point. Inhalation anesthetics have a huge safety margin and they're easy to use, which makes them really nice. But because of cardiac shunting that can happen in some species, it's important to remember that you can get sudden changes in depth. You can have altered or increased induction times and altered recovery times. So intubating with an ET tube and breathing for them with intermittent positive pressure breathing is very important. And there's two ways of using inhalation anesthetics. On the left-hand side is an example of one, which is just kind of induction. You'll use this for very short procedures or not super painful surgical procedures and for health exams of things that are very dangerous. So the picture on the left bottom corner for you guys, that is a boomslang. It's the most toxic snake on the African continent. If you wanted to do a health exam on that and you were worried about anyone handling it, you can just knock it down for 5 minutes to have a quick look. Okay. At the end of the tube where you can see the plastic glove, there's a little cotton wool ball there that's covered in isoflurane. So it's basically being used as an induction box. The picture on the right, we've got an intubated tortoise. This is when you would be using inhalation anesthetics for maintenance. This would obviously be for longer procedures or for surgeries. When it comes to maintenance with reptiles, you should be placing an endotracheal tube, but it should only be placed once the animal is already induced. Please don't do this conscious. It's not very fair and it's not very nice. When you are talking about your anesthetic machine and the circuit that you're using, anything that is less than 5 kilos, you can use a non-rebreathing system, and anything that is more than 5 kilos should have a circle system. Just be conscious of dead space. The longer your pipe work and the smaller your patient, the worse it's going to be. So adjust everything according to the size of your animal as well. In terms of anesthetic support, any anesthetic requires your reptile to be breathed for. That means you need intermittent positive pressure ventilation, and it needs to be done gently. Pulmonary tissues in reptiles are fragile and their lung volume is small. You don't want to accidentally rupture, burst, or damage any lungs. If you are using or considering breath rate for induction, then it's 4 to 12 breaths per minute. Remember, the larger your animal, the slower its respiration rate is. If you're talking about respiration rate for maintenance, then it's 2 to 6 breaths per minute. You also need to think about thermal support when you're doing your anesthetics. Your animal needs to be at that species' optimal temperature, not an optimum temperature for all reptiles. That doesn't exist. Don't pretend, don't lie to your client if you don't know what it is. Look it up. It's a species-specific optimum temperature, and that's what you need to be at for their anesthesia. It's really important that your animal is warm before you start. That's because, remember, it's linked to metabolic rate. If your animal is cold, they are not going to go to sleep very well, no matter which mode of anesthetic you're going to use, whether it's injectable or inhalation. Also, once they are cold, it's really difficult to warm them up. Remember, any animal that goes through an anesthetic is going to struggle to regulate its body temperature for up to 24 hours. That's mammals. With reptiles and their very unique physiology, it's even longer, especially because they need their external environment to regulate their body temperature. Then you need to think about fluid support. Okay, this in a surgical context or an anesthetic context is only given when it's indicated by history or through presentation of the animal. So you don't always have to give fluids. If it's required, though, it's important to do so. And you can give this either subcutaneously, depending on how much is actually required. If you need proper volumes, then it needs to be intravenously, intracelomically, or intraosseously. If you're giving fluids IV or IO, then it should be given at 2 mL per kilo per hour. But again, please look these figures up because there is variation between different species. The moral with any anesthetic and anesthetic monitoring is that if you want a safe anesthetic, you need to have a good protocol, you need to know your protocol, and you need to understand the physiology of your species. That is what makes it safe, knowing your animal and knowing your drug. So how do you monitor an anesthetic in reptiles? In terms of depth, you'll look at muscle relaxation. This is the same as it would be in a mammal. Limb withdrawal reflexes, so that's your deep pain when you're pinching. Are they moving their legs away? A bite response, I would only try this if you're pretty confident that your animal is asleep, because you obviously don't want to get bitten, and you definitely don't do this with anything that is venomous. Your corneal response, you can use an earbud, like what's pictured in the top right. Please make sure that that earbud is wet so that you're not drying and damaging the eye when you test it, but you're looking for that nictating membrane to come across. And the blink reflex as well, depending on the species. Probably the most important is your righting reflex. When you put the animal upside down, does it stay or does it try and correct itself? If it stays upside down, it's asleep. Then you're good to go. Okay. And then obviously its heart rate. What is its heart rate doing? You need to, when you're doing any anesthetic, also monitor your cardiac heart rate rhythm. And that can be done with a stethoscope. It can be done with a Doppler. It can be done with an ECG or with a pulse oximeter. It's important to understand that pulse oximeters are not very reliable in reptiles because reptile hemoglobin is different to mammal hemoglobin. Their red blood cells are nucleated. Ours are not. So your pulse oximeters are not going to work very well. The best method of monitoring the heart in a reptile during surgery is your Doppler, which is what you can see photographed here. The Doppler is also really helpful if you're a little bit weary of whoever's helping you monitor your anesthetic, because you don't physically need to rely on anyone else. You can hear that heart while you're busy doing whatever you're doing, and you can recommend or advise whoever's helping you to do whatever they need to do without you having to unscrub or get yourself non-sterile again. In terms of respiratory monitoring, you can do this visually or you can use a capnograph. And then it's really important also to measure body temperature. Your thermometer here can either go up the cloaca or you can use an esophageal probe. You want to measure core body temperature, not peripheral temperature. So remember, your probe needs to be in deep enough. And then blood gas analyses don't really work in reptiles, so this isn't something that's done, but I guess it's a watch this space because maybe we'll learn more with time. With regards to recovery, you should be monitoring your reptile throughout the recovery, and you want to see regular voluntary respiration and movement before you actually say that they're awake. Resedation can happen very commonly, especially with inhalation anesthetics. Isoflurane sinks. It's a heavy gas. So if you have your animal waking up in a bucket or a container, which is just a standard thing, then they're going to be exhaling the inhalation anesthetic. It's going to be sinking down into that container where your animal is sitting. They're going to be breathing it back in, and they're going to renarc. You have to watch your animal until it's fully recovered, and you need to make sure that it is not going to fall asleep again. Sorry about that, guys. Then you need to keep them at their preferred temperature, okay, through the entire process. Make sure they stay warm while they're waking up as well. Don't let their body temperature drop after your anesthetic either. And for anything that is going to be placed near water, especially your aquatic or your semi-aquatic species, do not put them near water until they are fully awake. They need to be able to protect their own airways from aspiration, so it's okay to keep them away from water. Make sure that that is the case until you're confident that they're not going to drown. If we look at recovery for inhalation anesthetics specifically, there's a few other things to consider. And one of them is that you should really be careful to not over-oxygenate your animal. When you are using inhalation anesthetics and a machine, generally the oxygen that's coming into your machine is medical grade oxygen. So it's pretty close to 100% oxygen. If your animal is getting that, their respiration rate is going to go down because they're being super exposed to oxygen. And remember, they already have a reduced respiration rate. So when it comes to reptile anesthesias, where possible, ventilating them with room air is safer than pure or medical grade oxygen. When you are giving them oxygen, you're also ventilating for them. You're breathing for them, which means you are going to be exposing them to it, and their respiration rate is going to decrease even more. Because of these kind of natural processes that are happening as a result of the natural physiology of reptiles, when you are recovering your animal from an inhalation anesthetic, if they are not waking up the way you want them to, you may need to flush their lungs and make sure that that inhalation anesthetic is actually coming out of them the way it's supposed to. To do that, you can exhale down the breathing tube. This is not something that you're going to find in literature, okay? And it's something you need to be very, very careful of doing. Remember that reptile lungs are very fragile and that their lung volume is significantly smaller than ours. So if you're going to be doing this, you need to watch your patient carefully so that you don't damage the lungs and you don't overinflate them or pop them, God forbid, okay? Make sure that you're being gentle. When you flush the lungs, you're exhaling down into the lung. What you're doing here is relying on two reflexes. You're filling the lung with CO2. And when any lung is filled with CO2, the automatic reflex is to gasp, okay, to inhale. When you are overfilling or expanding a lung, you're also tickling those baroreceptors and you're stimulating an exhalation. So in essence, by giving them a breath like this, you are kickstarting the exhalation-inhalation response and the breathing. Just bear in mind that when you do this, you're probably going to get isoflurane coming back at your face. And vet school will hate me for saying this because you're not supposed to overexpose yourself to isoflurane. But if you are working with any exotic, that is going to be the case. When you put an animal in an induction box and you open that box, the isoflurane doesn't just magically disappear. It's coming out into the room as well. So just be very conscious and careful of your exposures because you need to. It can affect us as well. If all of these options aren't working, so room air, you've helped flush the lungs and you're still not satisfied that your animal is waking up the way it's supposed to, you can use doxapram, but typically I've never needed to if I've just followed the appropriate physiology of the animal. Okay, finally, surgeries. Just a few extra considerations. I know strictly speaking, this isn't anesthesia, but because reptiles are so different, I'm sneaking this in here. When you are doing surgery on reptiles, for lizards, Your approach has to be a paramedian approach. So that black line in that top right picture, and that is to avoid that large central abdominal vein that I was mentioning when we were talking about injection sites. If you cut down the midline, which is what we're taught to do in most of your mammals, you're going to cut straight through that vein and you're going to make your animal bleed out. You could tie it off if you work fast, but you obviously don't want to have to do that. So just paramedian approach, avoid that major blood vessel, you'll be just fine. For snakes, slightly different approach. You want to cut between the first and second or second and third row of dorsal scales, so along the side of the body. The reason why we do that is twofold. One, snakes don't have legs, so they move their entire body along their bellies. And if you cut on the belly, not only are you allowing the full body weight of that animal to go onto your incision site, but you're allowing it to get dragged through a whole bunch of other things. And obviously we want our incision sites to stay nice and clear and clean, and you don't want to expose them to any unnecessary things. Then in terms of closure for your surgical sites, really important that you use the right suture technique. We are taught with most of our mammals to use things like intradermal sutures or single interrupteds. None of the typical patterns that we would use in your mammals are what you should be using in reptiles. When it comes to the skin specifically, you have to use a horizontal mattress pattern. In your mammals, this is a tension relieving pattern, but for reptiles, you're using it for something altogether different. Scales cause the skin to invert, and if you use other normal techniques, when you're stitching, you're only going to be pulling scale to scale. You need a pattern that is going to cause an eversion so that you are stitching mucosa to mucosa. So you use your horizontal mattress sutures, which are technically tension relieving sutures, to cause that eversion to get mucosa against mucosa. What that means for reptile surgeries is that they always look ugly. You get this puckering lip appearance, and it always looks red, raw, angry, and not very nice. Our clients judge us on what our outside appearance of the surgery looks like. That's the only thing they can see. So vets are normally very good at stitching, arguably in most instances better than human doctors. In reptiles, that's not the case. You can forget about that. It's never going to look pretty. So just warn your owners so that they understand why, because that's just what you have to do. And then the other major difference is that these stitches need to stay in for longer. They need to stay in for 4 to 6 weeks, which is significantly longer than your mammals. And your animal is probably going to shed in that time frame. It's okay if they do. Just tell the owner to leave it alone. If they're worried, they can come to you so that you can check. But if they pull the shed too much at that spot, they'll actually cause dehissing or even your stitches to come out, which is what you don't want. So rather just leave it alone. It's okay if the body's shedding. It means it's healing, and then they can keep going. Some common procedures that you might see: egg binding. Okay, this is when an animal retains eggs, either because it's not been given appropriate nest sites or it doesn't feel secure, or in this photo, strictly speaking, not eggs yet. These are overstimulated follicles in a bearded dragon. Can happen very commonly and is why you should think about spaying any female bearded dragons or iguanas. Then there's foreign body removals. Reptiles love to eat everything. Honestly, absolutely everything and anything. So this is a procedure that you'll be doing a lot, and it's important to understand, obviously, their anatomy and the anesthetics to make sure this goes smoothly and safely. This is a bearded dragon that ate a marble, that big green thing inside its stomach. And then you might need to do biopsies as well. This is a liver biopsy on a red-tailed boa to look for IBD, or inclusion body disease. The liver is the bright red organ kind of in the middle bottom of that picture. The pink bit on the top is the muscle, and then the honeycomb looking thing at the back, that is the lung. Everything is very close to each other, so you really need to know your anatomy. You need to have the right tools. You need to be confident in what you're doing. And then there's orthopedics. I think orthopedics is probably the most fun in reptiles because it becomes a little bit more of an art and less of a science. A lot of the equipment that we need to do things in reptiles doesn't exist, so you get to be a bit creative. The tortoise, leopard tortoise on the left, or rather the middle of the screen, her name's Ugly Betty. She came into a practice that I worked at when I first started as a vet a decade ago. Someone decided they wanted to see what was going on inside her, and they used a hammer. You can see that circular piece of her carapace that is floating. Underneath that is lung. So every time she's breathing, it's moving, which means it's never going to heal naturally because it's too mobile. So made this weird contraption looking thing, glued it to her carapace so that we could slowly pull that piece back up so that it would then be in alignment with where it should be, but also holding it stable while we were busy doing that. We had to do it this way for her specifically because when she arrived, she had a really, really bad infection, and we needed to make sure that we weren't trapping anything in the grooves underneath surrounding that circle. But other things that you could use, I know it sounds crazy, but little clips on the back of bras, you can glue them around the edges of the carapace and then wire the bits back together. On the right-hand side is a flapneck chameleon with a broken humerus. She was hit by a car. Do you think we make small enough pins for reptiles? No is the answer. So that is a hypodermic needle. Comes in a sterile packet, so it's sterile. And you can use the hub to push that pin through, and the beveled edge acts like your sharp bit of your pin. Realign your humerus, goes down as an IM pin, and that stops the lateral movement of your humerus. The problem is in anything else, you would have used an X-fix as well, but this bone is way too small and it's too little. So now we have lateral movement fixation, but no rotational fixation. So we need an X-fix of some sort, and that bottom right picture is a paperclip that's been bent and modified to act as a splint to keep that leg from spinning on itself. The moral of that is that your basic principles apply. So I know I've gone the entire presentation telling you that reptiles are different, because they really are. But if you don't know what you're doing, we get hammered in us through the entirety of our degrees about cats and dogs. Go back to your basic principles. If this was a mammal, what would you do? And then do a little bit of homework and figure out how you adapt that so that it can be the right thing for a reptile. Okay, everyone, that is my lecture for today. I hope you guys learned some stuff, but I'm happy to answer questions.
Thank you so much, Dr. Jessica. This was really fascinating. It was really interesting to see how you work with those smaller, tiny reptiles. Yeah. Okay. Now our audience, is time for questions. If you have a question, please raise your virtual hand. Then I'll give you an opportunity to ask your question, or you can type it in the chat if you would like me to read it for you. Yeah, since I already have the mic, I will use this opportunity to ask my questions. As you were presenting, I kept on wondering, how do you have any tips that you can share with us on how you handle nervous or aggressive reptiles before induction?
So you need a team. That's really, really important. I'm very blessed where I am. I'm based at Hoedspruit Reptile Center in Hoedspruit, and the team of reptile, like herpetologists at the center, obviously know exactly what to do. I think the biggest thing to consider for you guys, wherever you end up, do not let anybody that you haven't seen handle for you. Okay, if you're worried about it, rather you be the one to handle. But then you need to know that whoever's doing the vet side for you, you trust doing that, if that makes sense. Okay.
Yeah.
We have the advantage of the drugs. So I can use this case as an example. When I was in my second job, we had a Mozambique spitting cobra come in as a rehab case. And I was the only exotic animal vet there, and everybody else didn't know how to handle. Now, Mozambique spitting cobra is obviously a very toxic snake, and it's going to try and defend itself. Reptiles are not aggressive, they are defensive, and they don't know that we are trying to help. So as a vet, if you are going to get bitten, you are genuinely going to get bitten because they're going to be acting in self-defense. So you need to make sure that you're safe. Because I was the only one that could handle, but I still needed my hands to do my job, we put the snake in an induction box and I knocked it out. And then it was safe to be handled because it was asleep. That picture, I can go back to it, but where the snake was in a glass tube with the isoball on the side, Those restraining tubes are really, really helpful for vets working with venomous snakes because they don't have to be asleep to be in there. You can have them awake. It keeps the bitey end away so you can examine the rest of the body and you're safe and nobody's touching anything that can get hurt. But having someone that you trust that you can call in to hold for you is better. And if you don't have that, then anesthetize your animals so that it's safe for everyone around.
Thank you so much. And you have partly answered my next question, but I'll still ask, maybe you can share a different story. What has been the most memorable or challenging reptile anesthesia case that you have handled?
Probably the most memorable was a little chameleon that came in. She had been attacked by a dog, and the person who brought her in was the dog's owner. And she arrived, and he's like, "Oh, she's busy laying eggs." And she wasn't laying eggs. The puncture wound from the dog is where her eggs were coming out. And she was not in a good way. So I was the only one, myself and a curator, left at the zoo, and we had a very quick discussion about what we wanted to do, and we decided that we would anesthetize her and see if we could incubate the eggs. I did not think that she would survive because of the damage that she had, but we try and turn rescues, into a positive where possible. And I did the surgery. Her lung was ruptured. She had a huge blood clot. Obviously, the eggs coming out the side of her body. We did everything, and she woke up.
Wow.
And she did great. She did
Wow.
absolutely great. Reptiles are absolutely incredible animals. They can go through the most insane things, and if you give them a chance, they can have that. The problem is that you need to be comfortable and confident that you can manage the case. And I mean that both in a, do you think that it's fair what you're doing? In which case, don't do it. And also, can you manage the pain? Because like I said, we really struggle with pain management in reptiles. So just because you can fix it doesn't mean it's the right thing to do if you can't stay on top of keeping it happy. The emotional and psychological well-being of the animal is just as important in reptiles as it is in any other animal. And if that animal is in pain and it's scared, it's not going to heal. And then that great surgery that you did is worth nothing. But she did good. She's fine. She's been released, and yeah, she's great.
Nice. All right. There is another question in the chat from Hamza. Hamza Ruben. Hamza is asking, why is there a difference in the methods used to hydrate reptiles, like using POC when we want to hydrate the reptiles, when the deficit is less than 5%, and other methods for maintenance, and what dose do we need POC or S?
Okay, so I can't give you a dosage because it's going to be too broad. You're going to have to look that up for the individual species. But the first comment was on just managing fluids, like that first slide, on managing fluids in reptiles overall. And the idea of that as a concept is that the maintenance rate, so just what a reptile should consume every day in terms of fluids, is 10 to 30 mils per kilo. Most of that is, well, again, it depends on the species. It might only be in food. It might be because they actively go and drink. Some things like your tortoises, they don't drink necessarily every single day. They can store water in their bursa, which is why if you pick up a tortoise and it pees, it's really important that you give it water again, because that is a very important fluid store that it had, especially in winter when it might not see water again until the next rainy season. So the maintenance rate itself changes with different species, but a safe estimate is 10 to 30 mils per kilo per day. If your animal is less than 5% in deficit, you can give it orally because it's the easiest to give orally, rather than trying to use any of the other access points. But being less than 5% in deficit means they're not really very dehydrated. If the animal is properly dehydrated, you have to give them fluids where they can absorb them properly. And that would mean either IV, so intravenously, either intrasalomically, or through the bones, intraosseously, which remember, intraosseous is only in things with legs. The reason why oral things don't do as well in reptiles, and this again really depends on what you're giving, is because they have that really low metabolic rate. So you want things that are not doing well to have rapid absorption of things, and that means the gut is not the choice with reptiles. In a surgical context, the fluids is, or rather an anesthetic context, the fluids are normally transient. It's just for the period of time that you're doing your anesthetic, and maybe a little bit afterwards. So for that, IV access or intraosseous or intrasalomic is better than paras, because you obviously don't want to put anything in the mouth when you're doing your anesthetic because of that risk of aspiration. You want to protect that airway.
Thank you so much, Jessica. Hamza, are you happy? Yes, I can see he's clapping. That means he's happy, and all the reactions. All right. Another question. What is the most common mistake that inexperienced veterinarians would make when applying anesthesia in these animals?
Probably the most common is not looking it up. I think all the vets that I have helped as a referral vet, their heart is always in the best place, but sometimes common sense just seems to disappear. This is not a reptile example, this is a mammal example, but we are taught to weigh every single animal and work out a drug dosage. And I had a client last week call me, and I say a client, another vet, call me because they had two rats come in and they didn't know what to do. And it was an adult rat and a juvenile rat, and they gave them the exact same dose of medicine. They never weighed them.
Oh,
and I know it sounds obvious, but for whatever reason, when it comes to things that are not like the normal animals that people see, the common sense thing seems to just disappear. So just stick to your basic principles and do some homework. It's okay to look things up. You don't need to tell the client that you're doing it, okay? Find an excuse to leave the room, go do some reading, or whoever's making the appointment for you needs to tell you more than just reptile, like ideally what snake or what species it is so that you can go and do your homework first. You need that grace. I've been doing this for 11 years. I don't know everything. None of us can know everything. I have to look stuff up all the time. It's okay. If you do need to discuss that with the client, think about how you package it. It's never a problem if you package it properly. Also, find other people who are happy to share information, because all of us will have seen something that someone else has not. We should be sharing our cases and we should be sharing our knowledge. I know not all vets think that way. I'm a very firm believer in that, and we should be sharing. You guys are welcome to ask me questions even after this. I'm more than happy to. There's going to be time zone differences and things like that, but it's okay to get another vet's opinion on things. Again, when it comes to a client level of this, they're getting second opinions for free. Just package how you tell them that properly. No problem. No one's going to be upset with you for getting another vet's opinion for free.
Yeah, thank you so much. I think the biggest problem that we make is we panic in such situations. We you need to calm down and just think about it, this most of the times people get to panicking. It's like the way humans are made, but then it's something that we can practice. Okay, when there's a situation, just breathe in and out and then think about it. Yeah, thank you so much, Jessica, for that. I can see we have a hand up from Aaron Chipara, who is a final year student. Aaron, you can unmute and ask your question.
All right, so my name is Aaron Chipala, as Sarah has already said, from Malawi, final year student at Ghana. I'm very much interested in the reptile renal bypass system. I would like to understand that, can we take the advantage of this renal bypass system, maybe when treating maybe run infections, okay, I mean like the kidney infections. Can we take this advantage maybe to administer high doses of antibiotics just to treat the kidney infections because of this renal bypass system? I think with when treating with the normal dose of drugs, it can get flushed out that much quickly, as you said it. If I got it correct. So can we administer high doses of antibiotics just to treat the rhino infections? Thank you.
Aaron, it's a great question, which I cannot give you an answer to. I don't think anyone has actually looked at that before. What I would say is I wouldn't take the gamble and I wouldn't play around with it. We know the drug dosages that are suggested work, but they need to be given obviously in the right place. So what the thing that is taught about the renal bypass system is more the negative effect that it can have on our drug usages. So if you give your drugs, that's my little dog barking, sorry, there must be a squirrel. If there is if you give your drugs too close to the kidneys, okay, further back, then the kidneys aren't even going to let the body absorb it at all, and they just shunt it out. If you give the drugs in that first third of the body, so the very first third of the snake or the front legs of your reptiles, then it will absorb them and it will work. But again, that will only happen if your animal is also warm, because if it's not warm, the drugs aren't going to do anything either. So really critical for any patient or reptile patient that you are treating, that your animal is under the right husbandry conditions for that species, and that you're giving the injections in the right place. If we could use it for trickery one day, that would be great, but I don't know anyone that studied that, and I haven't seen any papers about it.
Okay, thank you very much.
Hi, Jessica. I'm just popping in while Stella fetches her laptop charger. So, cool. Yes, I just wanted to ask you a question from my side. It's quite a simple question, maybe. When you're taking blood samples from a reptile, I mean, obviously it differs per species, but is it like a really minute amount of blood, or it depends on how many tests you're running? But I'm just curious.
So it really depends, I think, on what you're trying to look at, where you are, and what it's for. And the reason why I say that, when I lived 5 years ago in the city, we would run full panels all the time. And when I moved here to Hoedspruit, we are nowhere near any big town or any big lab. So firstly, for any animal, if you don't take blood between Monday and Thursday, it's not going to get tested, because the courier guys pick it up at 1 o'clock on a Thursday. And if you don't get it gone before then, it sits until Monday. Then obviously your blood work's not good enough anymore. So it's a really, when you're trying to do something for diagnostic purposes and it's Friday and you're like, no, sorry, come back on Monday, that's not very helpful for us. Okay. So full blood work is not something that I've done for a very long time since I moved here, because it's just financially not feasible for most clients. And it's a mission to get it done properly. So you have to think about where you're working and what you can achieve or not. There is no excuse wherever you are to not at least do a blood slide. You can do that, easy peasy, right? And that takes a drop. If you have your own machines, great, and then you can run everything else. The labs will hate me for saying this, but most labs can run a full blood panel on 0.1 mils, which means significantly less than what we normally need to get, which is highly advantageous for things that are smaller, which is most of your reptile patients. But you need a good relationship with your lab. So what I would do before you take any blood, especially with your littlies, is call them and say, okay, I think it's this. What is the bare minimum I can get? What blood tube should it go in? Because different labs also have different requirements for different blood tubes. And then say, okay, I need to get this amount and I'll put it in this, and then I'll get it through to you by this point. So you need to look at a whole bunch of different things. I know that doesn't really answer your question, but it depends on where you are. And then make friends with your lab tech, and then you can get away with the smaller volumes for sure.
Thanks, Jessica. No, it does answer a lot of my questions. So yeah, it's a big thing that you're all working together, huh?
Yeah.
Jessica, there's a lovely comment, and then I'm going to hand back to Stella. Mengu Mpele says, I enjoyed the talk so much. It is almost the same as in our human patients. I like how you speak about your patients. So much respect. Orthopedic and pain, the orthopedic and pain messages caught my attention.
I think, my very, very first boss, when I started out, didn't believe that reptiles felt pain at all. And I can't tell you how many people I've bumped into that still think that now. And that's the biggest thing with reptiles, is because they don't make noise really, and they don't communicate in a way that most humans understand. They are often overlooked, and they really do feel pain. They just don't express it very well.
Thanks, Jessica. Thank you for your work. And now back over to you, Stella.
Thank you so much, Kirsten. And thank you so much, Mengu, for the lovely comment. And it's really nice to see that we had someone from the human medicine joining us today. And thank you for joining. Jessica, one more last, I know it's 9:30 now. I just want to ask one small question from me.
Yeah.
I'm very interested in small animals. They steal my heart, those ones. Yeah, so how do you approach the anesthesia in very small reptiles like geckos and hatchlings? How do you tackle them?
So, well, ET tubes can be interesting. I use catheters without the metal stylet, so just obviously the floppy bit. You need to make sure that the tip isn't too sharp, and obviously that it doesn't go too far. But you can do everything the same. You need to be very careful with your pipe work, that it isn't super thick. You want thin pipe work, not very long pipe work. And you need to be very gentle. Often with your very small things, it's not ideal, because you have no idea of the concentration of the meds you're using, but rather having them in some form of like a mini induction box or like a little face mask is better, because you don't want to do too much or accidentally like hyperventilate them and damage lungs. Your baby, a baby gecko is going to be like this big. So there's not much you can do for that. But we are getting there with our technology and with our creativity. So splints, like I showed with that little flap neck chameleon, the hypodermic needles as pins. Like, the world is your oyster if you're prepared to be creative. Understanding that we're going to learn as we go through this, and that it might not always work. But if the end goal is actually to make sure that the animal is okay, then rather than the experience for us personally, then you know that your animal is going to be fine. So what I mean by that is, remember, you want to make sure you can manage pain, and you want to manage the ethics around what you're doing. So if you ever have a case where you're kind of like, I think I can fix this, but I don't know if it's the right thing to do, open it up to other people. This is maybe more in a zoo context or in a rehab context, which is a lot of the work that I do. I like to have a meeting with the owner or the director of the facility, then the person who'll be immediately taking care of the animal. And we do what I call an ethics committee. It's very formal sounding. It's not. It's a discussion with us where I explain what I think I want to do, what I think will work and why, and then the goalposts that I expect to see. So I want to see by this point the animal doing this, and by this point the animal doing that. And if the animal doesn't reach that goalpost, was there a reason, a logical reason to explain it or not? Did it pick up a secondary infection which we can manage, in which case we can shift, or is there no reason for it? If there's no reason for it, that's the time where you make your decision to euthanize. Because that's where, if you keep going, you end up in a situation where you look back and it's like 6 months later, I should never have put the animal through everything that I did. Having your goalposts, very, very important. The more you invest in an animal, the more you want it to keep going well, the more you're going to push those boundaries. So everybody needs to be on the same page with that when you start.
Thank you so much, Jessica. With that, I think we have come to an end of this session. And Jessica, I would like to thank you so much for your time, for sharing with your passion with us. We could see how passionate you are on reptiles, and I know you have inspired inspired one of our students here, and they would like to be like you. And yeah, thank you. And we're looking forward to having you again. And to our students, thank you so much for being good students. We really enjoyed interacting with you. And everyone, have a good day.